I'm John Geddes. I'm a Professor of Epidemiological Psychiatry at the Warneford Hospital in Oxford. Bipolar disorder is a mood disorder. In other words, it affects the way we feel, so whether we're happy or we're sad. And with bipolar disorder, patients or people who suffer from it either have elevated moods, in other words, they're abnormally happy, but sometimes irritable, very overactive, full of energy, which sounds good, but in bipolar disorder it gets so intense that it can actually become a real problem for the patients. They might end up spending a lot of money or taking a lot of activities on that they can't complete. The other side of the disorder is that people suffer from very low mood. And this is depression, which stops people from functioning, means they're not sleeping, not able to become active, not do their normal activities. And one of the key things in bipolar disorder is that most patients suffer from both elevated and depressed mood, and so quite often it can be very difficult to manage life because they never know whether they're going to be depressed or their mood's going to be elevated. If I'd recently been diagnosed with bipolar disorder, then I'd want to ask my doctor about how one reaches that diagnosis, how I can be sure that is the diagnosis, and I'd also want to know about what I might be able to do about it. Is there any treatments available that can make the course of the illness better? Is there anything I can do myself to make it better? We make the diagnosis of bipolar disorder mainly on the history, but also the examination. So the doctor who's conducting the diagnostic interview will be looking at the behaviour of the person in front of them. There's no diagnostic test like brain imaging or blood tests that one could do for bipolar disorder. And so one really needs to look at the nature of the symptoms and how they've affected the person over time and the severity of them. Treatment of bipolar disorder is going to vary a lot from one individual patient to another, and it really comes under several domains. It's not as if we can just usually give a tablet or a particular form of psychological treatment. Quite often the treatment of any person with bipolar disorder has to take into account psychological factors, often includes medication, and may include work with family or relatives to try and get them to understand the disorder as well. And underlining the whole thing really is that the individual patient needs to make sure they know as much about the disorder and the way it affects them so that they can access care appropriately and use treatments in a way that seems to be best for them. Amongst drug treatments, probably the best established is lithium therapy, which obviously is widely known, but it is the drug that's got the very best evidence in terms of reducing relapses. It's best in terms of reducing the manic side of the illness and is less effective overall for the depressive relapses. Then, of course, there's psychological treatments, and some patients benefit from cognitive behaviour therapy. There's other forms of psychotherapy, such as family-centred psychotherapy or psychoeducation, or indeed an interpersonal and social rhythm therapy, which is more concerned with the relationships with other people and with the way that the person manages their rhythms, such as sleeping and eating. The impact of bipolar disorder is lifelong, and in fact the World Health Organization have found it to be one of the most important causes of disability, of course, because it affects people during the most important periods of their working lives. Recovery does happen in bipolar disorder. Rather than a complete absence of any symptom of mood disorder, what seems to happen more is that people learn how to cope with the disorder, minimise the amount of treatment they take, but take it appropriately, and therefore very much reduce the negative impact that the disorder has on their ability to function in life itself. So, for example, they might still have some mood variability, but the severity will be less. And recovery will usually occur both by taking the available treatments, finding out what does work for you, and making sure that you take as little as you can, but taking enough to make the difference.